Musings of a Modern Conservative. Short Essays on Various Political Topics by Thomas Hamilton. Section 3. Musings on Various Modern Political Topics. Essay 19. Working Out the Kinks. Musings on Healthcare in America. What is the difference between healthcare and health insurance? Are the two really tied together in a manner in which we cannot undo them? If one does not have insurance, then are they doomed to poor medical care? And if so, why? What does a system of health insurance really cover, and why does it cover so little or so much? Do Americans really need health insurance if all they seek is health care? Why does health care cost as much as it does, and if it costs so much, is it worth the money? Should health care cost less in general? If it should, then how could we as Americans reduce the costs of health care? What are the costs of health care? Is it simply the salary of a doctor and a nurse? Or are there more unseen and hidden costs? Who should have to pay these costs? How much time and labor should we spend on health care? If one individual cannot afford health care, should there be some way for them to get health care? How much of another individual's time and labor should be given to other individuals before it is too much? How much responsibility should one individual take for their well-being? As I muse on health care and offer a suggestion to what I think could alleviate some of the growing costs of healthcare, I would like the reader to keep asking themselves this question: how much of my own health am I responsible for? If healthcare has costs associated with it, how does one arrive at these costs? Rather than looking at healthcare as a very personal item, I would like, for the moment, to look at it as something like a television. In the healthcare world, I see three components, just like any other business: labor costs, the costs of doctors, nurses, and other staff, raw material costs, sheets, blankets, needles, etc., and of course, overhead, including electricity, facility, and administration costs. Could there be other hidden costs? And if so, what could be done to reduce the overall cost of healthcare? I see several unseen costs, the first of which are costs of insurance. How is insurance a cost, though? Doesn't the insurance company pay for the costs of healthcare? That is a grand ruse. No matter how much Americans like to think that the insurance companies pay for their healthcare, the fact is that as Americans pay into these insurance plans, that money is used to pay for their own healthcare. As was mused on before, insurance only assures against something, and the insurance company in question is counting on the idea that they will not have to pay out more money than you put in. In other words, your time and labor is going to an insurance company to provide you your time and labor at another time. If this is the case, then why the extra cost? Who is going to process all of the claims? Who is going to be needed to provide all the insurance companies with staffing to work all those claims through? What if this cost was reduced by 50%? What if half the amount of insurance was needed? What if a hospital only had to have one person to deal with insurance rather than two? Wouldn't this reduce the cost of healthcare? How could one afford healthcare, though? Isn't healthcare expensive on its own? What about looking at other products and services? It takes a significant amount of time and labor to purchase a new car, re-roof a house, repair a car, fix your plumbing. Yet, who makes the claim that these costs are so high that we need government assistance? I do not see a grand government program for plumbers insurance, so why healthcare? Even if we say that healthcare is the most important thing that a government can provide for its citizenry, should it be? What kind of labor and time would need to be taken from its citizenry to provide such a program? Isn't healthcare very personal, and doesn't it have to do with life choices as well? Should the labor and time of one individual go to another whom all their life has done drugs and abused their body? Should an individual who has taken good care of themselves have their labor and time taken from them in favor of someone who has not? Even if one could make such an argument, how much of their labor and time could be taken before no more? If healthcare is so personal, then how would an individual respond if they had no responsibility to keep themselves in good condition? How would one react if there was no risk or penalty in abusing themselves? Would it be reasonable for those of good moral character to supply benefits to those without? Suppose that we do not supply benefits to those individuals that abuse themselves. Could the government dictate such a program? Could it regulate such a program? This is the difficulty that is faced with all government-run health insurance programs. They have no way of saying no. Then, if the government cannot say no, then who can say no to an individual? And should anyone even be told no? If we wish to say yes to everyone, is the government providing insurance, or is it providing health care? If the government is providing health care, then are all those providing the government health care simply employees of the government? If they are, do we really want something as personal as health care in the hands of a bureaucrat, educated or otherwise? Should the government even be providing any type of insurance? Wouldn't it, by that measure, be better off simply providing a service, similar to the way it pays for police or firemen? This is where I get at odds with all of the debate over governmentally provided health care in all of its forms, universal or otherwise. Why does the government provide it in the form of insurance? Wouldn't it just be better off paying for it? If the government is paying for it, is it really paying for it, though? Whose time and labor goes into it? And if the time and labor of an individual is going into such a program, are they getting out what they put in? Or are they getting less? Or are they getting more and taking the time and labor of another individual? Is it reasonable for one individual to be forced to give up their time and labor to another individual, even if it is for a noble cause? And if it is, how much of one's time and labor do we need to relinquish before it is going too far? I would like to think that health care, such as it is a necessity, although it should come with its limitations. I do not think that someone should be forced to die in the streets. At the same time, I do not think that those that live healthy lives, as best that they reasonably can, should have to bear the costs of a smoker with lung cancer. To this end, isn't the government stopping, in general, the reduction of healthcare costs? If the government stopped interfering with the administering of healthcare, then could the costs be reduced? How could the costs be reduced by simply removing or reworking government regulations? What would happen if nurses were allowed to perform simple checkups and even other basic procedures without the approval or interference of a doctor? What if there were hospitals that had only nurses in them? What if the number of nurses doubled or tripled because they could provide more services to patients? Then what if patients could get routine care for less than the salary of a doctor? What if the cost for just being checked up on for the basic colds, minor aches, and pains could all be administered by nurses? The nurses would have larger salaries than they do now, but not to the degree of a doctor. It would then turn a doctor into more of a specialty. Thus, we would increase the supply of basic medical care. We could then eliminate the need of insurance for basic healthcare needs. If we eliminated that kind of insurance, then wouldn't we only need health insurance for more catastrophic events? If fewer people took money out of the system for routine events, then the insurance would actually act like insurance, and the costs would go down as not everyone would trigger the event. Would it also eliminate other problems, such as the need to collect insurance, and all the time and labor that was spent doing that would now be spent on providing health care instead? What of those that couldn't pay for such insurance? Or even the new more a la carte healthcare program? I would propose that the government get rid of all of its current healthcare programs, and instead, simply set up government-run hospitals alongside their private counterparts, but only provide limited services, and to any number of individuals. I would also offer free medical training to any individual who wished to become a doctor at any university of their choosing, so long as they spent their first 4 years after their training in one of these government hospitals. Wouldn't this be a better way of providing health care? Rather than fighting through all of the unnecessary bureaucracy, simply provide the care. Wouldn't we have to do something to make the government-run healthcare sustainable, though? Why would anyone use their own time and labor if they can use the time and labor of another? This is why, no matter the age or means, I would have some nominal amount of time and labor that would have to be paid upfront. Why make an individual use their time and labor? I have 2 reasons for this. First, that if the individuals are going to be using the time and labor of another, then they should take some responsibility for themselves. If they do not use some of their time and labor for their health care, then they are less likely to take care of themselves, as it costs them nothing to be unhealthy. If they don't use their time and labor, would they value the health care? Secondly, it would be used to supplement the payments that would need to be made to run the facility. Why would we need to supplement this health care? Isn't it supposed to be provided by the government? In that case, I would argue that the government is still providing it, but the tax or fee is focused on the individuals using the service. As with all governmental programs, it is the time and labor of the citizens of the country that use their time and labor to create and fund the program in question. In this instance, wouldn't it be more reasonable for the greater citizenry to provide only a portion of the healthcare costs, while the rest of the time and labor come from the individuals who use the service? While I do not claim that this is the only solution, the question is what other solutions could be more conservative, though? Isn't it the responsibility of all individuals to provide for themselves with their own time and labor without taking it from another? This is a true understanding of the conservative. But as all things that the conservative does, healthcare must be also tempered by some practicality. If the conservative takes on this idea, then what do we do to those that genuinely cannot afford healthcare? I would think that most conservatives with means would offer assistance voluntarily. Not everything, and not to everyone, but to those in need, right? Isn't that the moral thing to do? Help those in need when they need it? Aren't we conservatives more charitable by nature because we understand the nature of labor, because we do not want to see others under hard times? Don't we want to use our labor for good? Shouldn't we conservatives look to helping those in need? I do admit that the government forcing taxes on all of the citizenry is not the most conservative idea, but what of the grandness of our society? Could we conservatives reasonably set up such charitable hospitals on our own, like the aforementioned plan would do? If we could, how would we test the means of those that came in? Would we need to? Or would we just provide it to all those that walked in the door? And if so, wouldn't this be abused by a large group of fakers? Maybe even more than if the government ran the program. I think that using the government in this way to assist those in need can and should be something that the conservatives should begin to look at. If we do not begin to offer up solutions of our own, we will end up with a collective solution that removes all responsibility and choice from the individual, and then there will no longer be any time to provide a practical, conservative solution.